Hello everyone, another case. This patient, she came to our office and again aesthetic reason. She's complaining about her old bridge, so aesthetic. Uh, then again, one more thing, posterior, so function, and as well longevity. She already had an old bridge, as you can see here, is defective old bridge. The first step in planning our cases, utilize a communication tool between you and your patient. So in this case, what we did from the first visit, we showed our patient utilizing the 3shape digital smile design software how we can improve what exactly we are willing to do, what we can add to her smile to improve her final outcome. So show to your patient, communicate with her, then get the final approval. This is only a 2D virtual design, comes from the software to communicate, to be able to communicate to our patient, to be able to communicate with our lab as well. So from the first visit, we get the approval from the patient to go ahead. Now we started with the second phase. It's a collection phase where we need to collect all the information and data from the patient. So we started first of all with the intraoral design, with the intraoral scan. Then number 2, the CT scan, and as well the 2D and 3D photo. So this information, we send everything to our lab, and the lab will start designing her mock-up or her initial smile according to our plan, according to her original teeth. So what we can see here, the software will give us an idea if this case needs a preparation. For sure, this one, it's a bulky bridge, and since it's an old bridge, that means we need to remove the bridge first of all, then do a mock-up as a transition between the visits. So utilizing the 3shape model builder software, we are able to print out her models with the new design. So immediately we can just remove the bridge and replace it with a nice mock-up. But always again planning and planning. So as we said before, it's 80% planning and 20% treatment. Always you have to be ready. Keep a plan B. So if the first plan doesn't work, you cannot pause, you cannot postpone the treatment. You have to be ready for plan B or a second solution. In this case, what happened that we removed the bridge, and here the situation exactly immediately after removing the bridge. All her 6 anterior teeth, it's almost remaining nothing at all. There is no tooth structure. The issue that this patient, she's not complaining. There is no pain, no swelling, nothing at all. So what do you think? What you can do here? So maybe it might come in your mind to do an implant. So extraction and implants, extraction for the 6 anteriors or few of them or 5, 4s, depend. Then second, it's a bridge, long bridge from 4 to 4. You might keep this lateral to support, but what do you think? It will survive 6 pointing on anterior without posterior? 90% no. So the third option is also again extraction plus RBD, but I don't think so. In young patient, they will accept to have something removable. So you need to think about something fixed and immediately at the same time. Here the case again, this is the scenario immediately after removing the bridge. So none of these teeth had a root canal treatment, none of them. But for us, since we are using the advanced digital technology, and I know my software, the 3shape software, has a solution for every single procedure. So I am fully comfortable that my software, I have a backup in my office. I have a support comes from my third party, from my software. So based on my information that 3shape has a tool for post and core, then the thinking goes to do for this patient a 2-unit zirconia milled post and core plus the bridge, 6-unit bridge. This is the post which we are willing or which we will be using during our scanning. This post, it works like analog for our lab, like just to transfer the information for the tooth position and our post position depth and width. So we started our preparation, clean up the teeth, do some crown lengthening using our waterless machine, hard tissue removal plus soft tissue removal, all of that at the same visit, at the second visit. So first visit is the data collection visit, second visit is the treatment. No postpone for the treatment. So we started with the root canal, we did the caries removal, gingivectomy, crown lengthening, all this procedure, high complicated aggressive procedure at the same time. So once we are done, comes now to the scanning, and this case we already had before the pre-op scan, the original scan. So what I did, just only I add one more scan, which is the post scan and the preparation scan according to our pre-op scan. Instead of just re-scan everything again, you can just go ahead and ask your software and trim all the pre-op scan, and then you can scan your final. Here, after trimming, our final scan shows this one, the preparation for crowns, the post preparation for the 6 anterior, after root canal treatment, after cleaning all the caries, after crown lengthening and gingivectomy retraction cord in place to give us a clear margin. Then here's the tip, you need to lock everything. Lock all your scan, the previous scan, just keep the area where you will need to rescan again the post. So using the software tools, lock surface, then you can mark all the areas where you don't want the software to rescan them again. Here we are, we've added the posts, the scan posts inside the canal after the preparation, and make your canals ready for the posts. And I will show you how I scan in the end of this video, because I have only one scan post, and what I have here, it's 6 teeth, so I need that one scan post to fit all of these 6 teeth at the same time, at the same scan. So here the final scan with the bite, and this is the scan for the posts, 6 posts. And one more thing, once you're done, you can add one more scan for your temporary. After you finish from the first scan and the post scan, you can put your temporary, which comes from your model. So from your models, you can pick up the final mock-up and place it in the patient's mouth. This is our mock-up. Then you can add the mock-up as a scan. So you have now the pre-preparation scan, you have the preparation scan, the post scan, and the mock-up scan. 4 scans. This is the mock-up. This is how the patient left our office. So this is the mock-up. We'll give her some time for the gum healing, the adaptation, and to check also the phonetic for our patient, the functionality of this new restoration. Then we send everything to our designing software. We have to select the option of post and core plus crown. Then you connect all your crowns together in form of bridge. So now the question is, why you decide to go for crowns, for splinted bridge, not for crowns. Actually, when we are planning our case, we have a lot of parameters to take a decision. I don't prefer to go for splinted bridge unless it's needed. In such case, the patient, she has a history of she has an old bridge, and she don't have posteriors. She needs time to make an implant, and all the 6 anteriors, they are really weak. They are supported by the post. Even if you have the filial effect, still the teeth are weak. The lifetime for these teeth will not survive for a long time. By splinting them and adding to the splinting of your bridge, enhancing and improve your patient oral hygiene, showing him how to use the interdental floss, water floss, all these things, follow up of every 6 or less, every 6 months or less. This all will help to maintain the quality of your treatment and the survival rate. So the decision was made to go for a splinted bridge over a post. Now your lab will need to integrate or stitch your preparation scan, post scan to the library which has come from the software. Align the scan post. After the alignment, you need now to start the designing for your post. And the nice thing about 3shape, it has a wizard workflow. So you just go next, alignment, then next to the designing, then post design, then your final design. Again, in the post design, everything is clear. You just press next, 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 and then start with your designing. This is her post. This is her this is her mock-up scan overlaid, her final scan, and this is her final design, final restoration. For confirmation, you can add the photo comes from the smile design, the first initial design for this patient for confirmation, and for sure to improve the patient input. At the first design, the patient has her own input, so taking care of that, add the notes to your labs so he can change his design. And now, just to make sure from the height, length, because the patient during the temporary cementation for her mock-up, she approved the design, and then we are just make sure that the design is exactly the same from the length, width, and all other parameters. And this one, the final design for the bridge and the posts as well. So it comes as two separate components, the bridge and the posts. Then everything can be sent to your milling machine to mill the zirconia posts, and as well to mill your framework and the final bridge, adding some simple glazing, staining. This one multi-layer, multi-translucent, multi-shade zirconia. This one's after the milling. So this is the third visit. The patient came in, everything is ready. We have the bridge, we have the posts. We just did a try-in for our post to make sure from the fitting. Here's the ferrule effect. It's more than 2 to 3 millimeter. Check the fitting of your posts, and everything goes as we planned from the beginning. Then now it's a time for cementation. We don't want to cement the bridge, final cementation for the bridge. We need to temporarily cement our final restoration. Why we are doing that? Just as I said, what we did now for the patient, all in one visit, root canal treatment with post preparation and as well gingivectomy, soft and hard tissue removal. Even though we are using the waterless, which is high efficient technology, but still we need to make sure from the overall gum healing and the adaptation of her bone and gum over our new restoration. So by cementing our final restoration as a temporary, it will give us a time, and as well if we need to do any adjustment, so to make sure that the two components will not stuck to each other, we just place a Teflon tape here. So we place the posts and cover them with Teflon tape, and then place your bridge. So by the force which has come from the bridge, you are guaranteed that the post, all of them, 6 of them, all at the same position, all at the planned positions. So once we are done with the final cementation for the posts and temporary cementation for our bridge, here the x-ray to make sure from the fitting. Then this is the patient at the same day, just a few minutes after we have finished from the cementation. See, still there is some remaining cement. We'll go through the scanning process for this case. So we started with lower scan. You can see here how easily the Trio software is able to detect all, even the free end areas and the gum. Done with the lower, go next for the upper scan. This is the pre-op scan. This is her old bridge. Again, easy, fast scan, high quality scan. So we have now the lower, the upper, and now it's a time for the bite scan. If you notice here, the software are able to adapt the upper one, but not the lower, but utilizing the software tools, we are able to stitch the bite both together. Now we'll go next. We'll remove that pre-op scan, and while the assistant is removing that, I'm preparing the patient, retraction cord, dry, everything's clear. Now we start the scanning for the uppers. It's the preparation scan. We just go slowly, smoothly. But what happened here, I feel that there is an issue with the stitching, because I'm trying to stitch the pre-op to the post-op to the preparation scan. So, and I don't want to compromise my final result. I delete everything and I re-scan again. So again, after deleting, I will re-scan again the uppers, the final, after the final preparation for the uppers. Okay, we are crossing the arch, fill the scanner, fine, no any interrupt in the scanning, even though it's really hard case to scan. Scanning margin, make sure everything is clear, traction cord in place, no bleeding. This scan is after the waterless gingivectomy. So we already did gingivectomy here, we already did the crown lengthening bone removal. Software automatically will clean up your scan, mark your teeth, this blue area, it's the cutout, because the next it will be our final scan for the posts. So we are giving an idea to our software where will be the cutout. So the software will remove all this blue area. We can reduce the size of the blue area from the setting, but if you don't want, you can do it right away by lock all the surface. So whatever you will lock, the software will not remove it from the scan. Even if you rescan again the same place which you already lock, the scanner will not detect or will not over stitch that place. So we lock everything, all the margins, especially the margin. And sometimes when you are doing simple crown preparation and you need to scan under the gum subgingival, so you can place the your retraction scan, then remove the retraction, lock everything, and rescan again. So it's really a very helpful tool. Once we're done with the locking, make sure check your scan, then go for the post scan. And here the challenge, because I have only one post scan at that time, so I need to use that one post scan for all these teeth. So I started with the first one, I scanned. Make sure from my scan, try to detect the all surface of your posts, and once it's done, I locked that post. So I used again the lock surface tool to lock that post, and then or lock all that surface. So then if then I will remove that post and put it on the other tooth. While I am scanning the other tooth, the software will not, or my scanner, my Trios, will not scan that area anymore if I will not use the lock tool. And once I remove the post, while I am scanning, the Trios will scan again that side without the post, and it will compromise your scan. You will end up without a post scan for that place, for that area. So again, next I will speed up the video a bit. Done with the first one. See here, the software will never scan any lock surface. So I'm done with the second one. I lock everything, and I will do the same for all teeth. So remove the post from the lateral, put the post in the central, start the scanning for the central post. It's really complicated case, and it's not easy at all to scan such case. We reach already 3000 images, and still the performance of my scanner, it's really good and in high performance. So my scan speed did not interrupt. The quality of my scan still optimal. One more thing, just imagine you will do this case in traditional way. You have two options. You will do your fiber posts, and for sure you cannot do it at the same time because you're already just done with the endo treatment. So you will postpone for the next day, and you need to, or after 2-3 days, you need to place your retraction again. So you will give anesthesia to your patient again. Here we did everything at the same time: anesthesia only once, crown lengthening, gingivectomy, root canal, post scan, everything at the same visit. But in traditional way, you might need 3 visits, 4 visits to do all of that things. So in traditional way, you need to do fiber post, composite buildup, take an impression, send it to your lab, check the fitting, send it to your lab again, or you can just try to do custom made Richmond post. It's an old technique where you need to drop the wax inside the canals and try to take an impression for the canals. But here we already get the final scan and the post scan. So what we are willing to do, it's a one design process, one design workflow for the posts and for the bridge. So at the same time, our technicians are able to do the designing for our posts and for our final bridge. So we are almost done. So clean up your scan and then you're done. Go next for the bite scan. Scan the upper, scan the lower. Again, the same. For the second time, the software is not able to detect the lower, but I'm fine because I have the manual tool, which I can just detect 2 points, upper and lower, and the software will do the alignment, auto alignment. Now the case is ready. Post the process and send it to your lab. You can add one more scan. It's for your final mock-up. It's our mock-up. So we remove the post, remove everything, the refraction, put the mock-up as a temporary, supported by the premolars. Get a scan for that one, and again send it to your lab. So it will be as a guide for your technician who will do for you the final design. So we're done with the scanning. We'll go now for the lab workflow, the designing. This is how your lab will receive the scans. We'll start with alignment. We'll align the alignment, give an idea to the software what for where for which tooth. So the 4, where is the 3, where is the 2, where is the right, where is the left, and to know exactly the length and the place of your post. Then since it's a bridge, you need to check your path of insertion, detect your margin lines, now do the initial design, the post design. As you can see here, it's a wizard, so you can just go next, and in every step you can do your adjustment. So you can add, remove, smooth, change the design totally. And this is the final design. So you have the posts plus the bridge. This is the posts, this is the final bridge, and bring the lowers to make sure from your bite. Add your virtual articulator, check the occlusion for the patient, and adjust according to your need, to your patient bite, to your proposed plan. So done. Again, plan your cases, know your tools, always have or always be ready for a second plan.